Yes, let's do it
Yeah,
for,
that's
there
what
you
it
go.
is. Yeah. All right, so now we'll go back to share and, okay, and then slideshow. Okay, so everyone see that?
Yes.
Okay. So we're going to talk a little bit about difficult emotions and how to cope with them, respond to difficult behavior, talk about set boundaries and self-care. And if you have examples and feel like sharing them, please don't hesitate to do that, because that's really how we learn the most. So just quickly to go over the program, the EFR, we are the Employee and Family Resource Program, and we provide work-life resources and referrals. So anything that you're looking for help with, we can get you there. It could be parenting, it could be pet care, elder care, anything. Somebody to walk your dog, they'll do it all. We also do legal and financial support. So you get financial counseling, and you also can meet with an attorney for free and get a discount if you want to hire that attorney. We also do critical incident debriefings after traumatic events. And we also oversee the peer support teams, and every hospital has a peer support team, and it's made up of volunteer peers, but you do get paid if you're working outside your regular work hours. And we're always looking for people to join us, so just put a plug in for that. And I can tell you more if you're interested to email me or call me. So our counseling, very important. It's up to 6 visits free, no copay, and you could continue with the person if they take your insurance and whether they also work in the area that you're looking for help with, that it's a good fit. It's 24/7. You can do it on virtual or in an office location, and any life issue, anything. Could be work stress, it could be domestic violence, it could be parenting, anything that would affect you, big or small. It's free and confidential. We cannot disclose anything without your written consent. It doesn't go into any personnel or my chart records. It's completely separate, done by an outside vendor called Beacon, which actually, as of today, is going to be called Caron. So this is a great service, and anyone in your household is eligible, and any dependents. So if anyone, well, let me just show you this. This is also our website, which I highly recommend. And you can also schedule online with a counselor without talking to anyone. You can just go on this website. So that was really quick because I want to get to why you're all here. Does anyone have any questions? And, you could chat or preferably just say it because we're a small group. But whatever you're comfortable with. Okay. So no questions about the program. Feel free to contact me if you do have questions. Okay. So we're starting off just to want to recognize that things have been pretty challenging in the last 2 years, 3 years. I think everyone will agree to that. And this is just a little bit saying, most people are reporting feeling tired, frustrated, burned out. People have less emotional reserves, usual coping mechanisms. So not to get you depressed, but it's just to explain that we are coming into this period and where some of us are very stressed. And so this is a workshop to try to give you some techniques and help you with dealing with that. Anyone disagree with this?
No.
No, I didn't think so. I just was attending a planning session for a panel discussion on, how much more difficult behaviors have been in the workplace. So, it's a real thing. So what, you can chat or talk. What are some of what brought you to this workshop? What kind of difficult things are you looking to get help with? What are your stresses? What are your difficult situations?
I'll just say having more responsibility, with less time and needing to deal with, the emotions involved with that, not being resentful or angry, and just, setting more boundaries, what I can do, what I can't do.
Right. What you're doing is good enough. Right. Well, that's all good examples, but you touched upon anger, which is something that I want to make sure we cover. And you also touched upon boundaries, which is another area that we're going to cover. So any stressors, it's important that you can deal with your own anger and someone else's anger. So stress is anything that you care about that's at stake. And I think it could be many things. So one of the things that I wanted to talk about was what are working with a population of people who are facing these problems, who are angrier, more violent, and greater risk. Okay, and I know you're in the ED, so you see it right up front. Okay, thank you, Kelly. So raising your emotional intelligence helps you deal with challenging people, patients and their families or coworkers, or anyone for that matter. So I don't know if you're familiar with emotional intelligence, but just as a quick overview of it, I can't get into detail, but it's important. It really helps with dealing with stress and difficult situations. So first of all, it's an understanding of yourself. If you don't understand what's going on for yourself, it's pretty hard to deal with stress because you're not going to react from a place of knowing where you are. The other thing that helps is a desire to know and understand people. That always helps to deal with difficult people or situations. The ability to empathize and the motivation to persist and overcome challenges, not to give up. So first of all, understanding self. This is very important. Understanding how you feel, because if you don't understand how you feel or you don't take care of how you feel, you're going to react from a place that's not good for you and probably not good for the people around you. So when you think about also how you affect others, well, how do you come across? I just had somebody I talked to who lost the job quite a while ago, and she said, I didn't realize how overconfident and cocky I was coming across. So we have to understand how we affect others, and that means being open to feedback. And that means also looking at our own behavior. What are we bringing to this equation? And bringing yourself, making sure you understand where are you? Because a lot of times, one of the things I hear a lot of from people is I shut down, I keep it all inside. I don't want to feel this way. And really, accepting how you feel is half the battle, because you may feel, like Roberta said, angry, and it's not that you feel it is a problem, it's what you do with it. And so accepting whatever you feel, whether it's angry, frustrated, sad, whatever it is, understanding what you feel like so that you can do what you need to help yourself and therefore hopefully help the situation you're in. So you want to say, what am I feeling now? And what's my experience? What do I feel in my body? So understanding what you need is so you practice de-stressing strategies. So somebody was telling me that they had somebody they was working with, a supervisor, who was constantly criticizing them. And one day they just went off over the body of a patient and just lost it. And she said, she used a curse word. And it's because she wasn't letting herself deal with her emotions, and it built up. So you really don't want to have that happen. So if any comments or any questions on that, please talk or chat. I'm checking the chat. Okay, so this is also part of emotional intelligence, showing you're interested in others and seek to engage with them. I think that's pretty obvious, but sometimes people don't feel like we care, so we have to make an effort. Increases our ability to deal with conflict. So understanding, showing your interest, it might be as simple as using their name. Now, I realize, and Kelly probably can attest to this, that there are situations sometimes where somebody is totally irrational and nothing you do is going to make a difference. But we're really not talking about those kind of situations. We're talking about things that we can do something about. And often communication will prevent escalation. That is fact. So the ability to empathize. Think of a situation that you've had recently where you were upset about the way someone was treating you. And was it because there was a lack of empathy? Because usually it's when you feel like someone doesn't care. And also remembering that people are different, they have different experiences, so you never know what they're going through. And I hope you look at the second one, which is empathizing with yourself. So in other words, be kind to yourself, because if you're beating yourself up, it's going to be hard for you to handle someone else's difficult situation. So remember, I think, again, what Roberta said, getting resentful and setting boundaries and realizing you are doing the best you can. And that has to be good enough, because you can't do anything more than the best you can. And giving yourself credit for that is really important. So the fourth component of emotional intelligence is the motivation to persist. And one of the most important things is reaching out for needed support. When you're dealing with difficult clients or patients or their family members, reach out for support. If you need help, that's okay. And if you need to come in and talk to someone in our program and it's confidential, or a friend because it's getting to be too much, that's fine. Or you need to tell a supervisor you need some help with something, that's fine. And also just being able to be okay with the fact that we do make mistakes. We all make mistakes. We're not always going to handle everything perfectly. And when you do have a setback, it's to realize that it's part of being human and that you need to learn from the mistake. So the person who was telling me that she got fired, she said the next job she went into, she was much more humble. And she realized that, trying to see how her behavior was affecting others. How was she coming across? So you may have to ask people or get feedback about how they experience you and be willing to hear that, which is not easy. So before we go on, any comments, questions? Okay. So for instance, to use what Kelly said about working with a population of people who are angrier, more violent, greater risk, is making sure that you get help from your supervisors, security, and support for going, being in an environment that's difficult, realizing that that's a not easy thing, and that your responses are understandable if you're feeling scared or upset. So that's where you get into practice self-compassion. What are the kind of things that you would say to a friend? Can you say them to yourself? Because a lot of times people are great with their friends, but not with themselves. So I'm sorry to pick on you, Kelly, but you were the person who did give some feedback. So one of the things is just, what would you tell a friend who was working in the ED experiencing that? And can you tell yourself that too? So give yourself credit for what you're doing. So we're going to talk about anger now, because anger is a big part of dealing with difficult people, and not just anger of them, but anger in yourself. And that is unfortunately across the country, there has been a reports of the same things that are happening in Yale New Haven Health System, more difficult patients and their families. People are, fried, and unfortunately that often means they get angry. So let's look at anger. So this is an overview of anger. It's a natural response. A lot of times, I heard a story recently of a nurse who it just so happened that she was either giving an injection or I can't remember the exact details, but the patient happened to die. And it wasn't anything to do with what she did, but the family member went crazy and attacked her. So, that's what happens when someone perceives a threat. And you have different options, which I'm sure you've all heard of: fight, flight, or freeze. And everybody does express anger based on many factors, and it's often the tip of the iceberg. So we might not know what is underneath that person's anger, whether it's a coworker or a patient or a family member. What are their stresses? Now, that does not condone behavior that's not acceptable, abusive, or anything of that, or obviously physical, but it helps you to just step back and detach a little bit. If you can start to think, what's going on here? And you realize you don't know what's really going on. You don't know their experience with conflict. You don't know their values. You don't know if they just got evicted from their apartment. You don't know all those things. I had a client recently who, one of the patients, she's African-American, said a racial slur to her. Not acceptable. So some things are just not acceptable, and that anger has to be dealt with. So when someone becomes angry, again, it's really helpful to realize try to think about what needs are not being met. So need to feel safe, need to be heard. This one's a big one, need to be heard and validated. So many people will say, I don't know, I just wanted them to listen to me. Again, they should not be verbally abusive. People usually need to feel respected. This individual who got that, patient saying that, she felt, actually, it was just as bad because the workplace didn't really understand how painful it was for her. So trying to understand what someone might be going through. A lot of times people want to be in control, and when they're in places like the ED or, they don't feel in control. Again, it doesn't mean they can be verbally abusive, but it's important to understand where it's coming from. They want to be valued. They want to, sometimes a coworker may not feel competent. What other things do you think, what other needs do you think are not being met that might explain someone being angry? Okay, well, just you've seen some of the things, so let's just go back one more. Also, anger, when you're dealing with anger, a lot of times you're angry too. So the first place to make sure you look at inside is you. What are you angry about? Are you angry? And again, it's not the emotion is not a bad thing. It's what you do with it. So again, this goes back to the self-awareness piece. So difficult behaviors. What causes difficult behaviors? Sometimes learned behavior, they've basically gotten away with it. They don't know how to meet their needs by any other way. They don't know how their behavior affects others, or the cause may not always be clear. But again, it helps you set back and think to yourself, what's going on for this person? Again, it depends on the behavior. So does anyone have any examples? Of difficult behaviors and how difficult it was, or? Okay. All right. Well, let's go on. This is some of the ways that you can look at how you bring down a difficult situation. And everybody doesn't realize this for the most part, or you do. Actually, your verbal words are only 7% of the elements of communication. Most of it is your tone, your volume, your tempo, and your body language. So if you're raising your voice, obviously, or you have a sarcastic tone or something of that, or your body language is, with your arms crossed, then obviously you're giving a message. So be mindful of your nonverbal communication. This is one of the biggest ones. If you take time to validate someone's experience, it makes it more positive. So you kind of say, well, this must be hard for you, or I can't imagine what you're going through. Doesn't mean you agree, but it tells you validate, you have empathy. And this really involves excellent listening skills. So a lot of us, when we're listening, we're thinking about what we're going to say next, but instead, really listen to what the person is saying, and you can respond accordingly. Other ways: keep your voice even, calm, empathize with feelings, not behaviors. Behaviors are, that are unacceptable, have to be talked about. Ask open-ended questions. Try to offer choices when appropriate. Refrain from minimizing the concern. So, saying to someone, oh, it's no big deal, or you're overreacting. Even if they are overreacting, it doesn't help the situation. Talking down to them, of course, yelling doesn't help. Becoming defensive, and this one's a hard one. When someone's being difficult, it's hard not to get defensive. And of course, know your workplace violence security policies. When do you call security when you're in the ED? When do you call a supervisor if somebody comes into the office, outpatient, and is giving you problems? When you need to know when to do those things. And you need to have support. That's important. Any questions or? So I just put this in because sometimes it's good to just think about, in a situation, what would you really like to say? You're not going to say it, but what would you really like to put in your little bubble? And sometimes people will share the things they really would like to say without the profanity, but you can do the profanity to yourself. But you know what? It helps get it out, because you really want to say, knock it off, or who the hell do you think you are, or whatever it is, but you can't because you're a professional. But being able to just kind of imagine that little bubble sometimes helps you kind of de-escalate yourself and your own emotions. You getting grounded in yourself is very important. And that's why mindfulness and knowing how you feel is very important. So this is another thing. This is important to you. Here are some options. I'm sorry you feel this way. Some of these will not be appropriate in certain settings, but often they are. Let's take a break and think this through. It's always good to do a timeout if you can, depending on the situation. So, strategies to continue: breathe. Stop and breathe. Simple. Take a deep breath, take 3 deep breaths. Think about, pause before responding, even if you need to remain silent. And that goes to mindfulness, grounding techniques. Say, before I say anything, let me just, stop here. And sometimes you have to look at your own thought processes. Maybe when we talked about what's behind anger, that's also true for you. Maybe you have some irrational thoughts that are going on that make it more difficult. In between, also practicing self-care is going to help you deal with difficult situations, and practicing self-compassion. Boundaries. You mentioned boundaries at the beginning, Roberta. So if you look at the bottom, because we're running out of time, if someone, though, comes abusive in language or behavior, it's very important to set limits. Unfortunately, this kind of behavior makes it difficult for us to communicate. We can't discuss this if your offensive language continues. In order to discuss things, I need you to speak to me in a more civil manner, because those values represent your own self-esteem, and you have a right to not be abused. Nobody should be. You're doing tough work. Does anyone else have some strategies or examples of situations that have happened?
I had a situation happen where I was trying to coordinate something with somebody from the university.
Uh-huh.
Uh, I coordinated with her admin at her direction, and about 5 minutes later, she called my personal cell phone. And when I picked it up, she didn't even say hello. She just started yelling.
Oh, that's definitely.
And she said, "Why would you do that? Why would you set it up that way? Can't you?" I think she said something like, "Don't you pay attention?" And, just started berating me. So I did keep my cool to an extent, but I just immediately cut her off and I said, "Number one, you're not going to speak to me that way. Number two, I did it that way at the direction of your admin, who did it that way at your direction. And number three, you will no longer call me on my personal cell phone. All of our correspondence will be via email, or you can call my work phone."
Good for you. Is this Tara?
It is.
Good for you. So you maintain your cool.
I did.
Yeah.
And
so
when I
that's-
hung up, I had a few choice words to say alone in my office to myself.
well, that's where you go to the bubble.
Yes. But while I was on the phone with her, I did maintain my composure. Yes.
Yeah, and that's really, really crucial because, if you go on her level, then it's not gonna get anywhere. So,
Right.
you're just gonna escalate it. So definitely, it sounds like you handled it well. And her behavior was unacceptable.
It was. She never apologized, but my director stepped in. He's very supportive.
Mhm. Well,
And-
that's
and
another thing, getting,
Yeah.
getting your director or supervisor to hopefully step in and be supportive.
Yes, that is very important
Yeah, if you don't have that, it definitely makes it harder.
for sure.
Right. So that's good. You did the right thing. So keep this in mind and let, when you feel this is coming up, stop and think about, how am I feeling? What do I need to do? I mean, if you knew right away, which was good. So you handled it well. So just as we finish up, thank you for sharing that. This is just practicing. Continue to make sure that you're practicing good self-care. You've heard it 100 times, but it's so true. So that when something does happen, you're going to do the best you can. Be gentle with yourself. Give yourself credit. Not easy what you do, and it's not easy when people are difficult or giving you a hard time. So these are just some more, well, you see all those things. Take one day at a time, talk it out with colleagues, do your bubble, keep a little bubble somewhere. Just somebody told me that she does that and it really helps. Make sure you do these kind of things. Take a break, get out of the office or the unit and just, even if you have to walk around the block or the unit, just, do it. Would you be, yes, I can email the slides. Absolutely, I will do that. I have all your addresses. Make sure you do movement, take a walk, cut yourself slack. This is the one that I think is really important. You're welcome. People are so hard on themselves. Look at your self-talk. And then, and this would be just if here's also just ways to disconnect when you go home. Make sure that you try to leave work at work and so that you disconnect from it. And think about what you have no control over and just try to let it go. And if we had more time, I would do this, but you might do this with yourself. Think about the situations, what you might do differently. What did you learn from it? What resources could you have used? I think, Tara, sounds like you wouldn't have done anything differently, but what do you think?
No, I don't regret the way I handled it.
No,
I think that cutting her off and setting the boundary immediately before it escalated, because it was going to escalate. If she started out the conversation berating me, it wouldn't have gone anyplace good.
And using your personal cell phone is totally inappropriate.
Yes.
So anyway, that's the PowerPoint. Does anyone have any questions or requests or anything?
I think this would be good to discuss with managers and directors,
Yes,
because people in powerful positions, I think that there can be misuse of power.
so you're saying that the supervisors or managers could be difficult, absolutely. And that's very hard because they have, they have power. And so you're right, I agree with you. And I think some of this we've been doing, but we probably need to do more of it. But if somebody in a higher position is harassing you, then you make sure you get support and help on how to deal with that. And it may be that you have to go to human resources or, their supervisor if you can't resolve it. But nobody should be taking abuse.
It's not really even necessarily abuse. It's, just having kindness, having appreciation, doing things to prevent having these kind of situations happen. I
Right.
think people really need to feel appreciated.
Absolutely. And I saw Kelly just said lack of support. It's only, well, yeah, if you are only hearing what you do when you did something wrong, then that is not going to help you. So that's a very good point. And same with what you're saying, the same thing. People need to feel appreciated. So in those cases, you have to try to find other people who can be supportive of you, but maybe also if you think that you could talk to the person and ask for the support, you can try that if you think that would work. It may not. And you have to kind of gauge that. But yes, if you're not getting support, it will wear you down. And that's when you look to support from other people, coworkers or counselors or friends. Make sure you're getting support because it's hard work. All right, we've got to finish up, and that was quick. So thank you everyone for coming. I really appreciate it. And if you have any questions, you can always email me or call me. I'd be glad to talk to you or email. And I can send the PowerPoint out if you're interested. I know Shiraz said that. If anyone else does, I can do that.
Yeah, that would be helpful.
Okay. Well, thanks, everybody. Take care of yourselves.
Thank you,
Thank you.
Vivian.
Thank you.
Okay, bye. I'll send the
Bye.
slides out to everybody.
Okay.
Thank you, Vivian.
Thank you.
Bye.
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 Bye.